Welcome back to my channel, Army Biker DMD, baby. It's been a few days, but we're back. We're back in business, baby. Thank you for coming. Thank you for joining me today. I'm happy to have you here. I'm Joe Breaker, your host. And for a few days now, I've been trying to make this podcast. I think it's a topic that a lot of people are going to be interested on. Especially on the biker community, because we see a lot of this on the biker community. It's a situation that I always see and constantly see on my practice, and hopefully with this episode I'll be able to clarify some doubts and questions about this specific topic. So today we're gonna be talking about a condition that affects millions of people around the world, in millions of people in the United States. This topic is called periodontal disease. So some of you have probably seen, probably on your case or a family member, bleeding gums. Some of you may notice some change on your breath, some accumulation of hard plaque or film around your tooth. And you might be wondering, is this normal? I brush my teeth every day. I try to floss as best as I can every day, but still I see the things accumulating and growing up around my gums. So what is this? Well, if you have this type of questions, or if you have seen this in yourself or a family member, this episode is for you. So hopefully we'll discuss some things that and clarify some doubts that you may have in your mind. So let's start by talking about what periodontal disease is. When you come to an office, one of the first things that we're going to do is look at your teeth and your gums and do some x-rays. And also the hygienist or even the dentist will do a measurement of your gums, of the pockets of your gum. We call it pockets of your gums. So I'm going to show you in an image here. Hopefully you guys can see this. And I'm going to try to be in here also to see if we can make this happen. There you go. Let's put it right here. That way you can see me too. All right. So when we look at this image here, you may fall under one of these categories here, okay? One of the first things that we're gonna do is measure the pocket, which is this area around the tooth here that you can see here. We'll use a device that is called a perioprobe to measure this area here, okay? Now, a normal measurements, for those of you who don't know, it'll be from 0 to 3 millimeters. If when we measure your gums, you fall under this and we don't see any bleeding, you are going to be categorized as a healthy gums. Your gums are going to be categorized as a healthy gums. And on these cases, basically what you do is your normal cleaning. When you come to the office and say, hey, I need a cleaning, we're going to measure your gums, we're going to do some x-rays, and everything looks good, we'll proceed and do your cleanings, okay? But if those measures start increasing and we see some bleeding, some areas of 3 millimeters, 4 maybe, and we see a lot of bleeding, then that is a sign of the next stage, which is called gingivitis. And gingivitis is basically an inflammation of your gums, okay? So we have discussed what healthy gums are: no bleeding, measurements from 0 to 3, and then we also discuss inflammation of the gums, which is bleeding, and you can see that change from pink to red in some areas. You don't see big pockets yet. You see just kind of the same numbers, 3, maybe 4s in some areas, but you see a lot of bleeding on your gums and changing color from pink or from pink to red. So at this point, what we call that is inflammation of the gums or gingivitis. Then if you don't go to the dentist and you take care of this, if you don't start flossing, if you don't do some good oral hygiene at your house, rinsing, flossing, brushing your teeth often, then you're going to start seeing that that inflammation is going to continue to get worse. And then you're going to see not only inflammation, but when we do those measurements that I talk about, and remember, normal is from 0 to 3 millimeters. Now you're going to start seeing measurement from 4, 5, and 6s. And that is due to loss of attachment of the attachment structures that surround your teeth and keep it in place. You're going to start losing some of those fibers that keep the gums on the position that they need to be. And also you're going to start seeing bone loss around that area. And when we look at this next image here, if you look at this area right here, you can start seeing that some of the bone have been from this portion of the tooth when we saw that first image up here, and you can start seeing the movement or migration of that bone towards the bottom of the tooth. So if you see this image here, number 3, you start seeing that bone loss from the cervical portion of the tooth towards the bottom. Okay, these are called periodontal pockets now, which is due to a decrease of the bone level in that area. Okay, and at this point it's a mild to moderate periodontal disease, but when you start seeing pockets from 5, 6s, and even higher, it's an advanced or severe case of periodontal disease. And this can even get worse. It can go all the way down to your apex of your root, which is the bottom portion of the root of the tooth. And at those cases, you're going to see some mobility of the tooth, which could be grade 1, which is minor or no mobility, grade 2 or grade 3, which you see an increased movement of the tooth, even though it's still on the socket, but you're going to see a lot of movement of the tooth. And I'm going to show you some images here too that I have. You can see this case is a very, very severe case. You can see the accumulation of the plaque there. You can see how calculus, which is the initial film, the initial plaque, it turns into a hard kind of stone consistency structure that attaches to the tooth. And obviously this is a very severe case that we can see in the office, but you can see the accumulation of calculus, and this is full of bacteria there that it has caused severe bone loss on this case. And like I said, this is an extreme severe case, but if we don't take care of this situation, this is where it's going to get to. Okay. This shows some inflammation of the gums. This could be due to the crowding of the teeth and also some medication intake. We see a lot of this when people have seizures or epilepsy. Some of those medications are going to contribute to the overgrowth of the gum tissue. So, and we see this. In this case, we did some surgery on the gums, and this is the before. This is the after. Before again. And the after. Okay. I thought I had some that were right after the surgery, but I don't think I have it here. But you can see, like I said before, let's make this bigger so you're able to see this on the image again. Bear with me. There you go. We see this again, the before and after. You can see that we went from having tissues that are really swollen in this area. We went in there with some laser devices and remove that overgrowth of the gums there. And then this is the after. Here you see some spaces here because those gums migrated a little back. But basically you can see where we went from this situation to this situation. And this is probably 3 weeks after surgery or 2 weeks after surgery, and you can see the improvement on that. The patient was very happy with these results. Okay. You can see here that you can barely see that tooth back there to this situation here on this area. And the same thing with the anterior incisors. Okay. This is another severe case of periodontal disease. You can see the accumulation of that calculus that we were talking about. And specifically in these areas right here. This is a severe case of periodontal disease. And like I said, this doesn't happen overnight, but if it's an individual that don't seek help at the moment that they should have seek help, this is where we're gonna end up. Okay. This is just showing a case, a before and after of a case. This person came with some spaces, small teeth on this area right here and here, and then the after we prepare and did the patient's crowns. You can see the change on that beautiful smile. All right. Beautiful smile. But again, going back to the topic of the periodontal disease, you saw the severe cases, you saw the changes that go from having a healthy gums, no loss of tissue, no loss of attachments, no regrowth of the gums, to the initial stage of periodontal disease, which will be gingivitis. Remember here, you haven't lost any attachment, no bone loss at all, but you will see a change on the color of the gums and also the shape of the gums. You're gonna start seeing some swelling and bleeding. Okay. If you are under these situations, actually you should visit your dentist minimum every 6 months. But when you start seeing a lot of bleeding and accumulation around your teeth, you need to go to the dentist and get this checked, because if not, like I said, we're gonna end up in a situation where you're gonna start seeing bone loss, more inflammation of the gums. Your dentist, after they do the measurement of your gums, they're gonna tell you the size of the pockets that they see, and confirm that bone loss. And once you have this bone loss and you have lost some of that structure, we cannot bring that back. We can stop the process of the disease, hopefully in an early stage. We can do some soft tissue surgery, and that can correct some of the problems. But when you experience severe bone loss, that's a big situation, and in some cases it leads to loss of your teeth and patients having to wear dentures. So those are things that we need to keep in mind. This is why it's so important that you visit the dentist. I said that we see this a lot in the biker community, because the things that are going to increase the risk for periodontal disease, one of those things that include that is smoking, conditions like diabetes, and any behavior like I said, smoking or vaping, that is going to contribute to the changes on the oxygenation level of your gums and the growth of bacteria. No flossing, poor oral hygiene, family history of periodontal disease. Those are the things that are going to put you at risk. And this is why it's so important that you visit your dentist and allow them to do a comprehensive exam, to do measurement of your gums, to see what is going on. And no matter where or which dentist you go, you should always make sure that they measure your gums and give you the status of your gums at the time of the visit. Like I said, we want to be on the healthy side, but if you are in a situation that your gums are not healthy, don't wait. The longer you wait, the worse it is for us to treat the conditions, and in some cases you may even lose your teeth. So it's very important that we address this issue early during this stage. We don't want to wait until we get to the level of that I show you early, where we're gonna see this type of situation, because then at that point it might be too late. Okay, so very important that we address this issue soon. Very important that we don't wait until we get to this situation. Unfortunately, in this case, yeah, this person more than likely is gonna lose their teeth or lost their teeth. I remember this case. This was a case that we had to pull the teeth and do dentures. But when you see situations, inflammation of the gums, there are some things that we need to do, and one of those is going to be probably reposition the teeth. And once the teeth are repositioned, we can do the surgery. In this case, the patient was informed that we have to reposition the teeth and place it on the correct position on the art. But he really needed to or wanted to get the situation with the gums taken care of because he had a family event that he wanted to go. So in this case, we did the surgery, and then we also are going to treat the position of the teeth and eventually probably retouch again the surgery that we did. But like I said, you can see the changes in these cases. I put this picture here to show you how the inflammation can occur and how the overgrowth of the gums can occur also by not taking care of the situation. But you can see that compared to this picture here initially to that, you can see how much it improved and how you can see the teeth after going to the periodontal treatment and then the surgical laser surgery of the gums. Okay, so it's very important that we schedule those visits with your dentist every 6 months. It's very important that you keep or control the behaviors that are going to make this condition worse, like smoking, vaping, not flossing. It's very important that you floss minimum. I tell my patients to floss minimum twice a day, in the morning and before you go to sleep. Brushing, of course, using mouthwash, and you can use whichever brand you want as long as you're using something. But most importantly, do not wait to take care of your gums and your teeth. The longer you wait, the worse it is, the more expensive it's going to be for you. You have insurance company that they will pay for some of this treatment, but the longer you wait, the severe it's going to be and the less they're going to pay for that. So trust your dentist, visit your dentist every 6 months. My biker community, Social Freedoms are there to provide support. This is so serious that if you are in the military and you don't take care of this situation, it'll put you in a category 3 or non-deployable status. The military will not allow you to continue and perform your duties if you don't take care of this situation. So it's very important that if you are in the military, you take care of your teeth. They take this very seriously. Every day we see people that come from the military and they give you a specific form where you're going to be categorized in 1, 2, or 3. 1 and 2, class 1 and 2, they are still deployable. If you get put on a class 3, you're not going to be able to deploy or go overseas. If you are interested in going to places like Germany or anywhere overseas, they are not going to allow you to do that until you take care of that. So that's how serious this is in the military. And it doesn't matter which branch, Army, Navy, Air Force, they take this very seriously. Okay, so if you are a veteran also, I know that for you to have coverage for dental, you have to be 100% disabled to be able to achieve that. But also, it's very important that you seek help. There is a lot of relations between periodontal disease and heart disease. Studies have shown that those bacteria cause problems on your heart valves, for instance. So remember, conditions of the mouth have a direct effect on other conditions, systemic conditions in the body. That is why it's so important that we take care of our oral health. And I think that covers pretty much everything that I wanted to discuss today. Again, visit your dentist minimum every 6 months. Trust them. Go through a comprehensive exam, which is an exam in which we do all your x-rays, we measure your gums and tell you your status. And you don't have to do everything at the same time or at once. We provide sedation for patients that have situations with anxiety. There are a lot of things that we can do to make the experience a lot better. Trust your dentist, visit your dentist, take care of your teeth, take care of your mouth, and you'll have a much, much better life. And you'll be able to ride your motorcycle. Okay. If you're a biker, well, I know we're tough. I know we're tough, and we try to be tough in every aspect of our life. But it's very important that you take care of your mouth in all the situations that comes with that. Okay. Again, thank you very much for listening to my podcast. I'm happy to have you here. Thank you again for the support. Don't forget to go visit Souls of Freedom Military Motorcycle Association.com, soulsofreedomma.com. That's our website. You can in there check out the information. We're on TikTok also under the same name, Souls of Freedom MA, and on Facebook you can find us there. I'm your host, Joe Breaker. I appreciate you. Thank you very much. I hope this information was useful for all of you. God bless you all. God bless the United States of America, and God bless our veterans. Until next time, we'll see you. Stay tuned. Don't miss the next episode. A lot of good topics always. God bless you all. God bless our country, and God bless our military. Until then, see you later.